Well, good afternoon, everybody. My name is Scott McGann from the Falmouth Health Department, doing the Town of Falmouth's weekly COVID-19 update for October 22nd. So to give us a call, it's 508-495-7485. Our email is health@falmouthma.gov. And the website, I'll update the COVID information. This presentation will go on there as well, is falmouthma.gov, G-O-V. So for this week, our total case count is 2,045. There's been 43 cases this week, 4 probable cases. Our 14-day incidence rate has jumped from 14.4 to 19.7 because we've had 2 consecutive weeks over 40, so that's brought that up. And the previous week, again, this is a little bit of delay in the data because this is between 10/3 and 10/16, so it started to collect the week that we had last week, which was higher than the previous couple of weeks. And our positivity is 3.73, which is up from 2.88. So our weekly case trend, I put this every week. Like I said last week, 17, and we were 1748, now 43 for the last 3 weeks. I think 17 was a little low. This a data dump happened after we had put this together. So it was probably more like 25, and then 2 consecutive weeks around 40 to 43, but pretty close to what I've got reported here. So we're at 43 cases for the week, which is still on the higher side for us. And when I show you the county data in a minute, it's kind of similar throughout the county. Again, the flatter the lines are here, the closer they are bunched together, the better we're doing. And you see that we're sort of, in an upward trend or staying, higher. We're not really flat in terms of lowering the cases. The lower it goes, the flatter that line looks. So countywide, you can see sort of that ebb and flow that we're sort of seeing, obviously, because some of our cases go in here as well, but it's similar, sort of an up. So if you look at where Delta kicked in, is right over where the mid-July started, and you can see sort of that ebb and flow, up and down, up and down. We're sort of a little bit on the up. Not getting out of control. Again, without vaccinations, there'd be a giant spike in here. We're not seeing that. We're sort of seeing that ebb and flow in a case count that's higher than those low times that we saw last year, even without a vaccine, is because we know Delta spreads that much better. Some bit about the vaccine sort of starting to wane a little bit, and especially those in the older population. So you see that this, just looking at terms of cases, a higher sort of baseline for cases. Luckily, when we get into hospitalizations, it's not reflecting as high hospitalizations. Again, we've been vaccinated, so the disease tends to be much more mild for those who have been vaccinated, and we have a high vaccination rate. So you can see that we've been, last couple of weeks, 1 or 2 people in the hospital, which could be the same person. It can be. So this is just the total, what's the raw count, the head count of those at the hospital at this time. Cape Cod has gone down. Falmouth's been relatively stable. So that's where we are for case counts. So that's a good sign. It's not taxing the hospitals. Statewide, it's been pretty flat to lower. Those 1,200, 1,300, 1,500 around that per day. The positivity has stayed between 1.75 and 2 for quite some time now. About 100,000 tests per day are done. So it's been relatively sort of flat. When I show you the trends, you can see where it's been sort of, look at hospitalizations, been relatively flat, hasn't spiked up. Again, been vaccinated, a lot of vaccinations. The deaths are hovering on the lower, not seeing these big spikes, again, because of vaccination. Our positivity has remained very flat, and our cases are sort of on a downward trend, a little bit on the downward trend, at least statewide. Looking at the county, you can see Falmouth at 19.7 for an incident rate. That's how many cases Falmouth would see if it had a population of 100,000 on a daily basis. Since we don't, you would divide that number roughly by 3. And that gets you a rough estimate of what our daily incidence rate is. So somewhere around 6 cases per day, 7 cases per day, times 7 gets you to the 40s. So that's where we're at. So that's our daily incidence rate. You can see like Wellfleet's been struggling recently. They've done fairly well throughout most of the pandemic. We're sort of in the middle to high, a little on the higher side for that particular week, but sort of in line with the rest of the towns on the Cape. Slightly higher than the state average by about 1, a little over 1. Our percent positivity is sort of in that same area. Again, Wellfleet being higher cases for Wellfleet. Most towns have been in the 2 to 4 range for percent positivity. Talking about cases, I like to put this slide on and show you how effective the vaccine is. COVID-19 cases in fully vaccinated individuals. So there's been 47,929 breakthrough cases, COVID breakthrough cases. 3.27% of all those cases was resulted in hospitalization, and the death is less than 1%. So if without a vaccine, 47,000 cases would be a lot more than 371. So it shows you the effectiveness of the vaccine. Of all individuals, 1% of all vaccinated individuals in the state has tested positive. So again, vaccines are effective, no doubt. In terms of vaccination rates, we jumped to 74%. It's a slow sort of crawl, and the vaccination rate's gone up a little bit. In Falmouth, we gained 200 doses during the 7-day period, 111 first doses and 89 second doses. You can see that 90% of all eligible residents have had at least one dose, and 81% of all eligible residents are fully vaccinated in Falmouth. The entire population, because under 12 is not eligible at this point, we're at 74% fully vaccinated. You can still go on vaxfinder.mass.gov to get vaccinated. Pharmacies are definitely, I see appointments wide open at pharmacies. I do check that. The reason why I check it is when, if we see that there's delays in getting an appointment for a vaccine, we can do clinics. But as long as the pharmacies, the Barnstable County Health Office, Convenient MD, Community Health Center are able to meet demand, then we'll stick with what that system is. It's real simple, so that's the way we'd stay with it. If we see that they're struggling to meet demand, the county and us here in Falmouth, the health department, we could step in and add some clinics. Okay. If you're homebound, you can't make it to a clinic in Falmouth, you call us. Call the health department. We'll work with the VNA to get a homebound vaccination done. Testing's pretty much unchanged. There's still the school-based test and stay. Convenient MD is a big hitter. CVS, Falmouth Hospital with an appointment from your physician. The fairgrounds are still doing Sunday and Thursdays from 4 to 6. And the Community Health Center as well for testing. We're averaging about 12 to 1,300 tests per week in Falmouth. So people are able to get tested. That's a pretty robust amount of testing. A lot of new information on booster eligibility. Okay, so if you go on the website at the state, I just checked it before I put this slide together this morning. Nothing's really changed on it. It talks about Pfizer and the ability to get Pfizer if you're over 65, or if you're immune compromised and meet certain categories of certain age groups, you can get a booster shot. That's still on there like that. Anybody who's immune compromised can get if you've had Moderna or Pfizer. Now, that being said, the state hasn't updated it because this just came out from the FDA. So Moderna and J&J have been authorized for boosters by both FDA and CDC. The state information is, again, still pending, like I said. Use VaxFinder. You should be able to still get one, even though the state may not have updated their website, because especially through the pharmacies, they're locked in with the feds. But as of 2020, it says today the USDA took action. U.S. Food and Drug, the FDA, took action to expand the use of booster doses in eligible populations. The agency is amending the emergency use authorization for COVID-19 vaccines to allow the use of a single booster dose as follows. The use of a single booster dose, and I added half dose because when you read further down, it's a half dose, of the Moderna vaccine that may be administered at least 6 months after the completion of the primary series, so after you've got fully vaccinated. If you're 65 and older, 18 through 64 if you're high risk, and 18 to 64 if you're in frequent institutional occupational exposures, working at a nursing home, long-term care, congregate care, prisons, things of that nature, even teachers as well. So anybody who's working in a sort of a setting like that would also be eligible. The use of a single booster of J&J may also be administered at least 2 months after the completion of the single-dose primary regime to individuals 18 and older. Okay. The use of each of the available vaccines as heterologous, mix and match is basically booster doses in eligible individuals. So you can mix and match booster doses in eligible individuals following the completion of a primary vaccination with a different available COVID-19 vaccine. To clarify that a single booster dose of the Pfizer has always been the same. So the Pfizer's had this already. This is going to others. So that's the newest news. I just pulled that off the FDA's press release from the 20th. The state probably would be updating their website as well. But you can get a booster if you've had any of the 3 vaccines. Go to the Vax Finder. I think you'd be able to schedule those. The state's just lagging. The states should be posting something and cleaning their website up, but because I went on it today and it looks exactly like the same as the older one. But this comes right from the press release from the CDC. If you're confused by this, you just call us at the health department, Kathy or myself. We can answer your questions. As far as face coverings, on May 25th, the mask advisory, the Board of Health, Board of Selectmen mask advisory. The states basically got rid of all their guidance with the exception of wanting a mask for the unvaccinated, recommending those that are vaccinated with weakened immune systems wear masks, and masks are still required for all in public transportation settings. There is no guidance from the state. States are left up to them. The towns are left up to themselves to decide what to do. The CDC recommends unvaccinated wear masks, and the vaccinated should also wear masks in indoor public places in areas of substantial or high transmission. We'll talk about that in a second. Limited or stressed health system capacity and vaccination rates. And schools are still required to start the school year, and I think they have to hit 80%, which tough number to hit among schools. Obviously, you can't hit them at this point under age 12, so in your elementary schools. But the state does require mask wearing inside schools. So what's our decision tree? The decision making is in areas of substantial or high. So substantial for Falmouth would be over 100 cases, roughly 115 cases gets us into substantial. Right now we're averaging about 6 to 7 cases per day. I'm sorry, when I say over 150, that'd be for the week. Sorry about that. But in areas where we hit substantial or high, either with our positivity or our incidence rate, the CDC is recommending that's where you'd go to further mitigation. Obviously, it's up to us to decide that. The Board of Health is your primary body at which would make that decision. We were pushing it close several weeks ago when we were in the 50s to 70. Right now, we're in sort of that 40 range. We're not hitting that at this point. Our hospitalizations are definitely not hitting that, and our vaccination rates are very high, especially when you compare it to the rest of the country. So that's where we are with it, with far as further mitigation. I have gotten some inquiries about requiring it in certain circumstances. I would prefer personally to do it as a whole rather than piecemeal, because why is one doing it there? And then you say, well, about my place and so forth. So I think I've always been looking at it as a sort of a big picture, do it for everybody. But really that is up to the Board of Health to decide whether they would want to do something different. But that's the line in the sand that we've drawn, and that's based on the CDC's guidance for further mitigation. Talk a little bit about flu clinics. I'm going to be posting this. I haven't put it on the website yet. I plan on doing that this afternoon. Monday, November 8th from 11 to 1 at the Senior Center for those residents that are 60 and older. There will be high-dose flu vaccine available. The eligibility is 65 and older. Just request it when signing it up. We're asking for pre-registration. Just do it by November 2nd by calling the health department, 508-495-7485. The general clinic will be, without high dose, will be Monday, November 15th from 3 to 6 p.m. at the Gus Canty like we usually do. Last year was a drive-through. These are not drive-throughs. There won't be any high dose. And again, please pre-register by November 10th by calling the health department again at 508-495-7485. We're going to post the vaccination forms. There's different forms for different age groups, and there's also a high-dose special form, and I'll post them on the website. So please, we ask that you bring the completed vaccination forms. We'll have blanks available, but it makes it a lot easier and a lot quicker to do it than trying to fill that out. You can pick it up at the health department, or we can mail one out if it's soon enough, or you can download it from our website. And I'll have it posted at the health department page, hopefully by this afternoon. When you come to the clinic, you want to bring a completed vaccination form. Bring your insurance card. Wear short sleeves. It makes it easier to get the shot. And we'd like you to wear a mask as well. These will both be indoor. So again, November, if you're over 60, November 8th, you can go 11 to 1. If you want the high dose and you're over 65 and older, you can get that as well. Just request it while you call us that you want the high dose. And again, 3 to 6 for anybody 6 months or older. Again, if you're 60, 65 and you don't make the November 8th, you can come to the 15th. We're just not going to have high dose for that. Okay, so we need to just be able to get a specific order for that so we can, the VNA who's going to administer the doses knows what to bring. And so I'll be posting that on the website very shortly. So as a recap, our case counts have remained somewhat elevated, not in the 70s or the hundreds, but in the 40s. I'd like to see that get lower. There's not been, age brackets. It's not specific to any age bracket or grouping or anything of that nature. Vaccine eligibility is everybody over 12. Now, the 5 to 12-year-olds is pending emergency use authorization very soon. So we hope to hear that. The state's asked us to fill out a survey, which we have, in our ability to do clinics. They're really going to be pushing this through pediatricians. So the pediatricians have received the form. So you could try it through your pediatrician. We'll be, as long as we can get the doses, we'd run school-based ones as well. It's just going to be based on what the state decides to do with with shipping out the doses. We can do them through the health department, the VNA. We can do them through the health department with the Barnstable County Health, which has been doing our COVID clinics thus far. And also your pediatricians are going to be where they really want to focus this, because the physicians, the pediatricians know their patients. So there's going to be different ways to get it, and that should be coming down in the very near future. Again, third doses, CDC and FDA said yes for Moderna and J&J. Falmouth residents' vaccination rates are similar to other Cape Towns. Breakthrough definitely does occur, but showing you that previous slide, it's definitely highly effective in preventing severe cases. Again, we got 2 flu clinics, one at the Senior Center on the 8th, one at the 15th at the Gus Canny. Again, we'll have high dose for 65 and older only at the Senior Center clinic. And please pre-register. That way it gives us a better idea of how much vaccine to bring. And so we're going to be putting that on our website. So that's what I've got for an update for this week. And again, I'll plan on doing another one next week on Friday. And everybody take care. Thanks.